can loosen up this missed collar. Put it aside. Anytime you do trach care, biggest thing is you never ever leave the patient's trach unsecured. If it's unsecured or doesn't have a trach collar around it, if this patient coughs or moves around, that thing can just jolt right out. And that's an emergency. They're going to need it reinserted. And that's why you always have to have those two things by the bedside. So this right here is a disposable cannula. This is a non-disposable. This is disposable. There are two types of inner cannulas. There's a disposable and a non-disposable. You only clean the inner cannula if it's non-disposable. Most places now they have a disposable one, so then you don't have to clean the inner cannula. There are places that still have the non-disposable kind, and that's why we have to learn how to clean that inner cannula, okay? So, this is what I'm telling you. When you open your kit, this is all you have. You have to figure out how to keep all this stuff as sterile as you possibly can. It's super tricky. So what Dr. Mills and I have been doing for the previous semesters, this part of your paper is sterile. When you guys are doing your return demos, my biggest thing, which I probably will be helping in Paul, is just to maintain the sterile field as much as you possibly can. So we have another pair of sterile gloves because this only has one pair. Okay, so I'm gonna put my sterile gloves on. So this pair right here is sterile. And then you're free to manipulate everything that's in here. Your glove is sterile because whatever you'll be using is all packed into a little container that just isn't realistic. How I arrange my stuff is depending, like the process of how you're going to be cleaning the tray. So you'll hold your sterile gloves. I don't know why, but it's actually upside down. This is the drape that I was talking about. This goes right against the patient. You guys know that you have a 1-inch margin to work with. One side is shiny, another one isn't. The shiny side always goes against the patient's skin. So we can put that on. And then this is your hydrogen peroxide. This is what you'll be using to clean the cannula. You have pipe cleaners. You have a brush right here, which is what you'll be using to clean the inside of your cannula. All this thing is sterile. Another pipe cleaner. You'll have Q-tips. The Q-tips are to clean around the stoma and the faceplate, which is this part right there. And you'll be using normal saline only to clean around the stoma and the faceplate, unless it's visibly soiled with sputum and just looks really bad, and then you can use a little bit of sodium peroxide. The hydrogen peroxide. The hydrogen peroxide just loosens up that mucus. That's what you'll be using that for. You have this fenestrated dressing, which is what you'll be changing. This right here is a fenestrated dressing, so we'll be changing it. You have dry gauze, which you'll use to dry the cannula and also dry around the faceplate and under the stoma, or around the stomach. You'll have some ties. Honestly, nobody uses these things. You will always have a Velcro collar, which is right here. That's what we'll be changing. I do not have another one, but just throw those away. And then something else that you will have in here is your either normal saline or sterile water. So this is what's going to go in last. You'll use this to dry. Put that there. Again, you have that 1-inch margin. Have your Q-tips. Have your pipe cleaners. You have your brush. This brush, don't put it on top of these things because it gets stuck there. And then we have another pair of sterile gloves. So just be careful. Reasoning being, if you open this thing, even if you had a big sterile field that you're using, if you open any of these fluids and splash it around your sterile field, it's no longer sterile. You have to throw everything away. So this is a one-time use only. How I have had you guys do before, typically tray kits that are ideal. I think I was a little bit old-fashioned, and I'll talk to Prof. Kyle and see if we can get the right ones that we use in the hospitals. They come in different compartments where you can take the compartments apart. This is just really difficult to work with, but for the sake of your return demos, just do as much as you can to maintain the sterile field. So this is sterile right here. Divide your normal saline into two. So half of it will go in here, and then the rest stays in this little bottle. Take your Q-tips and put it into this bottle. Those are the ones that you'll be using to clean your faceplate and around the stomach. Your hydrogen peroxide, we'll just use one, but typically in the hospital you'll use both, and actually they come in big bottles like this. So open one, put it in here.
I would say Trach for me.
And that's all you'll be using to clean your cannula.
Probably the thing that I'm the most nervous about, it's like not like any of the skills, but you know, you see what's happening right now with my
We're still sterile. We haven't broken our sterile field. Assuming our gloves are in a package, they don't really come like this. So these are our sterile gloves. So right now we are going to break our first set of sterile. I say this is a two-step sterile technique. So reasoning being, you will have to take this cannula out. They're all manufactured differently. The key is they all go kind of like the same way in, same way out. And if you're meeting resistance, if you're trying to replace the cannula, you're doing it the wrong way. It only works one way. So pinch the ears on the side, pull it out, obviously securing the part that is on the patient. And be very careful because again, this is going to have secretions on it. You don't want to pull it out and smear everything that was there. This goes into the hydrogen peroxide. And then go ahead and take this dressing out. So when you take this dressing out, it's obviously been around the patient, the stomach site. You're assessing it. You're looking at the drainage around it, you're looking for the color, you're looking to see if it has any odor as well. You never show the patient the dress. Even wound care, unless you have a weird patient who just wants to see their gross stuff. I hope not. But you pull it away, you assess it, and then this is when you break your first sterile field. Take this off and throw them away. Okay? And then we're going to do our second sterile technique. This is going to look very odd because you'll be like, oh, it's okay. It doesn't look very sterile. Actually, research has it that it is sterile. So hey, let's do that.
So during our procedure, where would we lay that set of sterile gloves at?
What was that?
Where would we lay that set of sterile gloves while we're doing the first sterile procedure?
We'll give you guys some more sterile.
Like packets?
Yeah, they do come in packets. No,
Okay.
I do not know if we have the packets, and I'll talk to Prof. Niels as well. As long as you're talking to me, but now you're gonna be donning sterile gloves or your second pair of sterile gloves. I'll know that you will know to do that in an actual setting. So, first thing that we're gonna take is this brush. Take your cannula. That's the hydrogen peroxide. Just make sure that you're cleaning it over your sterile field, but you're not wetting anything especially this dressing here. So you clean it.
Okay. Alright, so again, or is it good to once I use?
Clean the outside.
Okay, alright. I just don't want to miss anybody.
If it needs to be cleaned again.
Okay.
One more time. Discard that. That goes into the trash can. Rinse it. And then we're gonna use the normal saline or the sterile water to rinse it again, okay? And then take these pipe cleaners, and then you're going to use this to dry your cannula. You go in one way, you can do one at a time, or you can do both.
In here practicing with this, if you guys wanna come take a look.
Do it one more time. Can dry the outside. And at this point, you've already assessed your patient to know how messy their trachs are. So you just grab as many supplies as you can, because you'd rather get more stuff and not use them than have less and have to stop your procedures. So you dry, throw those away. Take a gauze or two. You never do this. I've seen nurses do this and just supposed to drop it. Dry, and then put that away. Before you put this back into place, assess what it looks like. Assess to see if it's not broken, there's no lint, it's dry and ready to go. Again, it goes one way. If you put it up here, common sense, what does your trachea looks like? It's probably not gonna work. It goes in one way, right? So we're ready to replace this. So go in and pop it. On an actual patient, it's actually really easy to replace a cannula than our plastic guy here. Pinch the ears, you'll hear a little click. There you go, and that's how you know that it's in place, okay? Right now, we are ready to clean the faceplate and the stoma. These are the 3 Q-tips that I'm gonna be using. Clean around this area right there, you'll be scrubbing it. Always from clean to dirty. So from around the trach site to outside of the faceplate. Throw that away. A little bit of more normal saline. Clean around the stoma site. Throw that away. One more time if it really needs it. And if this looks like it's infected, if it's red, if the patient says that it's irritating, let the physician know. Chances are they probably need some antibiotic or something is going on. Clean that, put it away, and then we're going to use some more gauze. You can fold that nicely, and then dry around the faceplate and around the stoma site. Again, make sure that you're trying to stabilize this as much as you can. Last thing again you want is for this to become dislodged. Throw that away. And now for the most part, our sterile technique is pretty much done. The only thing that you have to be very careful is to keep an eye on this fenestrated area, that you're not contaminating it in any way. This is what goes against the patient. Also, these dressings are kinda, or they should be, one side should be shinier than the other, which is this side right here. And it also goes against the patient, and the whole reasoning is it seals the skin, so it's not letting in any moisture, that it's preventing the patient from getting any skin breakdown. Also, in the hospital setting, this does not have what we need, but you will need a tweezer to fit the fenestrated dressing around the patient's trach. But since we don't have it, we can go ahead and open one side of this collar. Don't take it all off. Have one side secured. Fit one side through. Main thing is just try as much as you can to not touch the middle part. Put it through, Velcro it. If you had tweezers, it would be extremely easy because you can just pull the dressing from the other side of the collar. So once you have that, you go ahead and tighten the collar. If you feel like the collar needs to get changed, there are always more collars. I don't know, I don't have one here. But if you had another one and you have to change it, just change it from one side. Kind of get your collar, let's assume this is our Velcro collar, because this really is not gonna work. So hold one side, take this side off first, leave that secured, thread your collar around, push this under. Let's see, this is the collar and it's in place. You can have the patient lift up their heads, or you can do it for them. I just try not to get in front of the patients like that. Some people are perverts of it. Hopefully you'll have good patients. And then this side should be Velcroed. Take this side off. And then fit the collar in, and then Velcro it in place. And then you guys already know the 2-finger thing. So you fit the 2 fingers around the patient's neck. You should only be able to fit 1 to 2 fingers through. Okay? Alright. So it's Velcroed in place. Go ahead and replace the tent or the mist collar or whatever you guys call it at your facility. And voila. It's all clean. The cannula is clean. You've changed the dressing. What do you chart after you've cleaned this? Or after you've done this?
You said what's on the
Yes. So
square.
you chart the previous dressing, if there's any drainage on it, and you also chart how the patient tolerated this whole procedure. Remember, a patient was on a 45-degree angle. Put them in a comfortable position. Make sure you lower the bed because it's super high, and then put the railing up. Give your patient the call light. Let them know to call you if they need anything. Also, always make sure that you've replaced their mist collar. If they're on oxygen, make sure that's on. Okay?
You said both procedures were at a 45-degree angle.
Yes, their heads have to be elevated while they do both. Any questions?